Unit 3 Professional English in Use Medicine Chapters 14 to 23. Complete the table with words from C opposite noun and adjective. Patient exhausted, fatigue, tired, lethargic, worn out, tiredness, drained. 14.2 Make a word combination using a word from each box. Complain of colors, out of sorts, present with, put on, worn out. 14.3 Complete the sentence with the correct forms of the verb present. A 67-year-old man presented with a 9-month history of increasing shortness of breath. The most common presentation is loss of consciousness. Cranial artery may represent a fever without any obvious cases. The patient usually presents with a severe sore throat. The presenting symptoms in the patient will prepare the visual to renal failure. Other conditions with similar presentation include acute cholecystitis. Reduced growth is an important presentation complaint of celiac disease. 2 months following presentation, the patient was able to talk. 14.4 Read the patient description of her symptoms, then complete the case report. I was well in the field months ago in the beginning. I just feel off colors and a bit tired, but lately I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 13. A 50-year-old housewife who had been well 24 hours previously on a list of tightness and exhaustion, he had put on 9 kilograms in weight in the last year before the complaint to their GP. Although she didn't eat more than usual, she was constipated and she noticed that her hair had started to fall out. 15.1 Find words in the box with opposite meanings. Adequate, inadequate. Against, for. Unlikely, likely. Severe, mild. Rare, common. Sudden, insidious. 15.2 Make word combination using a word from each box. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing vibration sense. 15.3 Complete the sentence. A 39-year-old man presented by a history of progressive abdominal distension over a period of 6 months. Blindness may be caused by vitamin A deficiency. The blended and purpura are caused by a normal platelet function. The white cells count is normal, so we can exclude acute leukemia. The yellow color of the skin and conjunctiva is probably due to jaundice. There was palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balances with adequate intravenous fluid. The anemia may be due to increased red cells breakdown. 15.4. Complete the conversation. Professor, what is against the diagnosis of pernicious anemia on physical examination study? The problem started quite suddenly, so it didn't have the typical neurological symptoms. He doesn't have any skin jaundice, and he doesn't have symmetrical paresthesia or accent vibration sense, and I couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or stone. 16. Label the diagram using words from the box. 1. Skull. 2. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Collarbone. 7. Shoulder blade. 8. Thigh bone. 9. Kneecap. 10. Shin bone. 16.2. Match the type of fracture. There is a break in the skin, open. The bone is bent and occur immediately in children when sick. The bone is broken into several pieces, comminuted. The broken pieces are separate, displaced. The broken pieces are pushed together, impacted. 16.3. Complete the textbook extract. Reducing fracture involves trying to return the bone to as near to the original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will myelinate, but it may go on to fixation. 17.1. Complete the table with words from A and C opposite. Verb, noun, and adjectives. Delay, delay, delayed, develop, development, 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 and develop. Distant, distender, and distended. Fail, failure, failed. Nourish, nourishment, and nourished. 1. A baby with the fetal alcohol syndrome may present a failure to thrive. Abdominal distended may be due to an enlarged liver. A small amount of alcohol in pregnancy can affect fetal development. Mortality from least can be reduced by later nourishment. Delay in one or more of the milestones may be the first sign of disease. 17.2. Complete the sentence. 1. After sitting, babies learn to crawl and then to talk. The child who has started eating food has been whining. Someone who is not very tall and said to be of short stature. The stages in a child development are known as the milestones. A child who is beginning to develop sexually has reached the puberty. 17.3. Write the common English name of each disease using your medical knowledge. Enlarged parotid glands, mumps, difficulty opening the mouth, lockjaw, rash and enlarged posterior occipital nodes, rubella, proximal cough with vomiting, whooping cough, papules with vesicle, fierce on talk, chickenpox, cold and cold followed by rash, brucella, sore throat and rash, scarlet fever, swollen joint and hair murmurs, rheumatic fever, fever followed by muscle weakness, polio, cold with stridor throat, eating 18.1. Complete the table with words from A, B, C opposite. Verb and noun. Inhibit, inhibition. Produce, production. Release, release. Replace, replacement. Secret, secretion. Stimulate, stimulation. 18.2. Complete the passage for the textbook. Says of GNRH are released from the hypothalamus and secretes LH and VHH. Triglyceride from the pituitary. LH stimulates testosterone produced from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to increase GnRH secretion. ASH produces the Sertoli cells in the seminiferous tubule to release premature sperm in the heaving, and AB inhibition causes feedback on the pituitary decrease AHIH production. 18.3. Complete the sentence. A diffuse charge affects many parts of an organ or gland. A localized charge affects only one part. His diet is deficient in iron. He doesn't get enough iron. Synthesization T3 and T4 increase the basal metabolic rate. 18.4. Match Mr. Davis symptoms. Do you prefer hot weather or cold? Heat intolerance. Is your weight ready? Weight loss. What is your appetite like? Eating more. What is your bowels normal? Diarrhea. Are you able to sit and relax? Overactivity. Do your hands shake? Tremor. Have you ever felt your heart beating rapidly or regularly? Palpitation. 18.1. Complete the table with words from B opposite. Verb, noun, and adjective. Accommodate, accommodation, accommodating. Constrict, constriction, constructive. Converge, converge. Delayed, dilatation, dilatation. Dilated, dilatable. Drop, drop, dropping. Oscillate, oscillation, oscillating. React, react, reaction, reactive. 90.2. Match the pictures. A. Dropping of lids. 6. Dilated pupils. 3. Irregular pupils. 2. Contract. 5. Squint. 1. Constricted pupils. 4. 1.3. Complete the track from a textbook. Retinoscopy. Examining the retina with an ophthalmoscope if possible, with the pupils dilated. To obtain the maximum view, look the pupil ioderma and flame-shaped and hemorrhagic and cotton walls exudate. Assess the state of the silver lining and note the presence of any narrowing, hair snipping, and arteriovenous crossing. Complete the case report. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius, pulse 100 per minute, blood pressure 110, 18. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with guardian, but not reading. There was no rebound, turnings, and mesas were felt. Power stones were reduced. 20.2 match the description of the stalls. Loose bodily ulcerative colitis. Loose, pale, and bulky celiac disease. Like colored obstructive jaundice. Black terry gastric ulcer. Small core. Irritable bowel syndrome. Clear, watery, and mucus. Cholera. 20.3 match the figures. Have you tasted black stools? Blood. How often do you open your bowel habits? Um, are you going to the toilet more often than the usual? Change in bowel habit. Is the size of the amount of the stools normal? Bold. What about the appearance of the stools? Color. Are the motion hard or loose consistency? Do the motion have unusual smell of offensiveness? 21.1 Write this time the simple English phrases for each of the medical terms below using your medical knowledge. Hysterectomy, surgical removal of the womb. Menorrhea, heavy periods. Salpingitis, inflammation of the tubes that connect the ovary to the womb. Cervical biopsy, biopsy of a small piece of tissue removed from the rear of the womb. 21.2 Read the conversation between the gynecologist and the patient. Menarche at 12 years old. Menstrual cycle every 4 weeks. Last menstrual period a week ago. Menorrhea, no dysmenorrhea, no discharge a little. 21.3 Now write the question the doctor asked. Menarche, how old are you when you started to get them? Menstrual cycle, how often do you get them? Last menstrual period, when was your last period? Menorrhea. Would you say they are light or heavy? Do you get clots? Menorrhea. Do you get period pains? Discharge. Is there a discharge between the periods? 21.4 Complete the case report. Case 15. A 45-year-old woman had been having prolonged periods lasting for 8 days with the passage of clots for 9 months. There was no bleeding between periods or often intercourses. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when the copper cord was fitted. She had had a normal pregnancy when she was 25. 22.1 Complete the conversation based on the case history. Doctor, what seems to be a problem? Patient, I've been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I've been had heart problems for years with tenderness and more than 100 meters without having to stop. I had to sleep on three pillows, and I had a menstrual bag replacement 3 years ago. Improvement since for a while. 22.2. Make the word combination is a word for each box. At rest, arterial fibrillation, cardiac output, air failure on effort, pitting, edema, premature beats. 22.3. Write the words the patient will use to describe the symptoms below. Dyspnea, shortness of breath, arrhythmia, irregular heart rhythm, orthorhea, breathless when lying flat, edema, swelling beginning in the feet and ankles. 22.4. Complete the case report. Case 13. A 60-year-old woman attended to their GP surgery complaining of breathlessness and before and had been increasing over the previously 8 months until it was producing problems at around 500 meters walking on the lever. There was no history of chest pain. She had had several episodes of fast palpitation which lasted 20 and 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles. By the end of the day, disappeared overnight. 23.1. Complete the table with words from A opposite. Verb and noun. Auscultate, auscultation. Examine and examination. Inspection. Palpate, palpitation. Percuss, percussion. 23.2. Put the steps of examining the hair and circulation in order according to 4 stages system. Measure the hair size percussion. Are there any murmurs? Auscultation. Feel the radial pulse, palpitation, log for clumping, inspection. Locate the apex belly palpitation, not any strills palpation. The order is D, C, E, F, A, and B. 23.3. A doctor is presenting the case of 43-year-old woman admitted in the cardiology department. On examination, she was periscope with temperature of 38.5. She was short of breath. Her pulse was variable between 180 and was irregular in time and force. Her blood pressure was 130 and 80, and her GBP was up 5 centimeters, showing normal movements and respiration. Her peripheral pulse were present and there was no central cyanosis. Her apex beats was displaced to the anterior axillary line, but still in 5 intercostal space. Her heart sounds were very interesting. When she was initially examined, it was not noted that she had systolic and mid-diastolic murmurs. Her best the apex. When she was examined some hours later, there was a barge periacal frictions rubbed all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation.